Hello everyone, my name is Al Hassan ADU-OPPONG. I did my research over fall preventions. Um, Title is Fall Preventions in Adult Inpatient on Medical Surgical Units. The purpose, of course, is to prevent falls in adult inpatient in medical surgical units. Variables included falls and fall injury rates, type of falls, patient fall risk factors, and fall prevention interventions. Falls in patients that are hospitalized is a very common problem. Fall affect about 2% of patients that are admitted into the hospitals. Fall rate in the US is between 3.3 and 11.5 per 1,000 patients day stayed. Some of the major causes of falls include the age, mental status, the severity of an illness, and the use of ambulatory aids. Medical surgical units have among the highest rates of falls. Of course, most of them are older adults who are at greater risk of fall. Fall may cause either minor, moderate, or severe injuries or even death, leading to additional consequences such as increase in hospital stay. The length is about 6 to 12 extra days, increase in cost per patient, which is about 14,000, loss of independence, loss of confidence, liability by the hospital, and limited bed capacity, need for specialized care, and transferring to long-term facilities. Statement of the problem. Falls are very widespread. They pose challenges to patient safety and increase expenses. Previous studies are either too general or too specific. There is a little research on medical surgical units. So the purpose is to explore various aspects of the adult medical surgical inpatient units and come up with preventive measures to prevent the risk of falling. The approach is patient-centered prevention interventions. The rationale for this is because falls are complex and falls risks are multifactorial. Theoretical framework. I use the Orlando nursing process. The major concept is the function of professional nursing, presenting behaviors, immediate reaction, nursing process, discipline, and improvement. Of course, the focus is on patient-nurse relationship, and I use the root cause framework, which allows for the root cause of a problem. What should be done to prevent future occurrences? Cause of falls, of course, older patients are more likely to have a fall. This is unit type, could be mental health, severity of an illness, and the use of ambulatory aids. Staffing levels, of course, is an issue when it comes to patient falls. Some of the things we can do to prevent: education, patients on their risk, putting reminders for the patients, clearing obstacles, and offering general assistance. Implementation of targeted falls prevention programs, target multiple interventions, falls prevention programs, and translating evidence-based research that targets patient-specific risks relating to falls prevention into our practice. Research questions. Question one of my research question is, what are fall and fall injury rates in the facility? Question two is, what factors predict patients' falls? Question three is, what interventions can be implemented to prevent falls? And question four is, what is the impact of these interventions? Assumptions, limitations, and delimitations. Assumptions. All facilities experience problems associated with patient falls. Facilities are interested in implementing fall prevention strategies, generalizability of finding. Limitations include small sample size, which may negatively impact generalizability, our bias in recording patient falls for participants of the study, the limitations, blinding to prevent any biases during this project. Our method, research design is a pre-post cohort research design. Sample is 5 community hospitals with medical surgical units. No history of implementation of fall prevention interventions. Patients, adults, 21 or greater. Length of stay, 24 hours or greater in the surgical unit. Data collection. Information on the patient will be retrieved from the patient's medical record. Baseline measures will include age, sex, diagnosis, medical history, mental state, and the functional dependency during the admission. Fall and injury related to the information will be retrieved from the incident report. Measures to be obtained will be the cause of the fall if found, any injury sustained, and the cause of actions taken by the staff. Data collection period would be admission until discharge, whether the patient is transferred from the unit or if there's any death that occurs. Privacy and confidentiality will be assured, and information consent waiver will be given. Instruments. Major instruments for this study would be patient's medical records and fall incident reporting system. The level of the measurement will be a ratio. Reliability. A pilot test will be done to enable and gauge the ease and efficiency of the instrument. Blinding will be to remove any reporting biases. Validity. Construct validity will be variables being studied, which are included in the instrument. Content validity, the research question, and variables are in line with the objectives of they are intended to measure. Plan for data analyze will be to use a descriptive analyst to acquire fall and injury counts. It's a multivariate analysis of frames rates using the Poisson regression model to acquire fall and injury rates. Multivariate analysis of the correct interventions using the Poisson regression model to determine the impact of the interventions. And here is references that was used during this presentation for the research project. Thank you for your time.